Good afternoon, everyone. I'm Dr. Nafsi. I'm the intensive care doctor here at SwedishAmerican UW Health healthcare system. I have here with me Dr. Jim Cole and Dr. Michael Polizzato, our leadership team. As of this morning, we have 106 patients in our hospital with COVID-19 infection. 23 patients are severely ill in the ICU who are on the ventilator with COVID-19 infection. I can tell you from my perspective as an ICU doctor, we are seeing an increase in volume and we are seeing an increase in surge of patients across the hospital right now. Most of these patients are unvaccinated. 90% of the admissions to the intensive care unit are unvaccinated patients. 85% of all hospital COVID-19 admissions are unvaccinated. We only know one thing which is effective against this virus, which is a vaccine. Prevention is better than cure. I urge our community to vaccinate themselves so we can fight this pandemic at a better level. Our healthcare system is exhausted. We have shortage of ventilators. We have shortage of beds. Nursing staff, nursing aides, phlebotomists, technicians, respiratory therapists, physicians, all of us, the whole healthcare system is burning out because of the amount of resources that are being utilized in taking care of these patients. It is extremely important for our community to come and help us. Get vaccinated, help us, help yourselves.
Go ahead.
Okay, thanks. So I know you mentioned that, you're filling up. Are you guys near capacity?
We are at maximum capacity.
And so what's going to happen if you are maxed out?
Well, we are trying to do our best in general. Dr. Polizzato and Dr. Jim Cole can also, comment on this. But as of now, we know that we are trying to rearrange some of the elective surgeries that can be done. And Dr. Cole can perhaps, comment on that as to how they are being rescheduled. But we are trying to pull all the resources in taking care of these severely ill patients right now. Of course, we are trying to do the best to our community to kind of keep on going with our clinics, with our surgical ORs, and provide the care that we can to our needy patients. But of course, we have to divert all the resources right now to our intensive care unit and the hospital admissions.
So at this time, you're not taking any non-COVID inpatient surgeries or any other patients, is that right?
No, we're taking everybody that comes. Everybody that comes to this hospital, we take care of, which includes COVID and non-COVID patients. And that's the burden, that's the challenge, because all of the patients in the community that have always required care for the congestive heart failure, the lung, the kidney disease, cancer care, etc., we still care for all of those. But in addition, we have over 100 patients with COVID-19, which is 100 more patients than we had 2 years ago, right? So it just makes it so challenging to do everything with such limited resources that are being consumed at such a great rate by the patients that that are really sick with COVID.
Are the problems? I'm sorry, go ahead.
I was just going to say, your question about are we at capacity? I think there's a misperception in the community that somehow there's some point where, we just filled the last spot and we shut the doors and nobody else shows up. That's not how healthcare works. We have 199 beds that are licensed for adults. We have actually just gone to the state and said, can we actually put more adults than that into beds? Because of course there's always, right now in the emergency department, not so much this morning, but yesterday, there's about 30 spaces to see emergency department patients. 20 of those spaces were taken up by people who were waiting to get into beds who needed to be in the hospital. In the meantime, we brought in recliners to put between the rooms where we normally see emergency department patients, so we could continue to see the emergency patients that were showing up. So there isn't some magic number that suddenly, once we reach that, we no longer, we shut the doors and we tell people don't bother showing up. We are over the number of patients that we can safely care for. We are in what we call a contingency and probably a crisis standard of care, which means we're doing our best to take care of everyone who shows up, but we know in our hearts that we aren't, if you had shown up 2 years ago, and you would get a different kind of care than we're able to give you right now.
Is that frustrating as
Extremely frustrating. I would say as a physician, I can speak for all our staff who are in the ICU, the nursing staff, the physicians, everybody who's working here. We are emotionally and physically burnt out. This is like since March of last year, we are dealing with this pandemic. It is extremely crucial to know that some people are younger than us. We have 25-year-old, 28-year-old, 30-year-old patients with families, with children who are dying, and we are seeing them die every single day. So it's frustrating and it's emotionally exhausting to take care of these patients who are from our community.
These are record numbers since the pandemic for you guys. The last 3 days, triple digits. That's
Yes.
horrible. And why is that? Is it because of flu season and the Omicron variant?
So we do not have any, I'm sure Omicron is on its way, it probably is here. I can't speak to that right now. We don't know whether it's effective here in the Rockford community or not. However, we do know that patients who are being hospitalized are unvaccinated. That's the bottom line. Okay, when you get severe infection, most of those people, like I said, 90% of the patients in the ICU are unvaccinated. The only thing we know that works is a vaccine. 52%, I believe, is the number for the county, in our county, of the people who've been vaccinated. So we have 48% people out there who are unvaccinated. So that is the only thing we know what works. We want our community to help us, talk to their families, loved ones, get the vaccine. That's the only way we know to fight this pandemic and bring an end to it.
And how are doctors staying safe while they're caring for these patients that are coming here?
Sorry?
How are doctors staying safe for you guys?
Well, we are all equipped with our PPEs. We are all being very careful. We are all wearing our masks in providing care of these patients. None of the care is being affected just because of these numbers. We are providing every single, medication that is approved to these patients. We are providing all resources in. We are providing ventilators, oxygen supplies. All of that is there, and we are protecting ourselves too, of course. But like I said, at one point, it just depends on how many patients can we see safely. And right now in our ICU, we have initiated what is called a surge mode, in which 2 physicians are rounding in the ICU all the time with the team, of course, pharmacists, nurse practitioners, all helping us out. So we are doing our best. We are working extra shifts, extra weekends to provide care for these patients.
What are some of the demographics of these individuals? Are these middle-aged people, kids?
We have, I don't care for kids at the moment. We care for adults only. So this is all 18+ patients, all ethnicities, all ages. We have patients ranging from the age of 25 to 81. So it's variable.
So an argument against the vaccine is people don't think there was enough time to make sure that it was truly safe, and they think it was rolled out too fast. Do you think that's a valid argument?
Not anymore. I mean, these vaccines have been studied, and now, of course, we are, like, I got my vaccine last year in December, so I'm already 1 year out. I've already been boosted. So I think we have enough data now to prove that the side effects that have been spoken about are very minimum or minuscule, and the benefit is quite extraordinary. So,
A follow-on to that is, I'm going to take this down so you can hear me better.
Sure.
But the medications, such as monoclonal antibodies, that have been designed and approved to treat COVID, have actually been invented no earlier than the vaccine, right? So if people are worried about the vaccine, but then they're still coming to the hospital to receive treatment, the medications are just as new as the vaccine. And, but the truth of the matter is, and I completely echo what Dr. Nafsi said, the only thing that we know that is repeatedly given people a benefit is the COVID-19 vaccine, the vaccines. But what we are seeing is, whereas initially we had a lot of older people, now that is shifted, because you asked about demographics, it's shifted to the younger population because we have more young people that are not vaccinated, and some of these people are in the hospital 60, 70 days. And, on a ventilator, so deconditioned that if, God willing, they can leave this hospital, it's going to take them 6-8 months to recondition in a rehab facility or a nursing home, but before they can even begin to resume a normal life. That's some patients, right? So we do see the worst of the worst, of course. I get it. 90% of the people that get COVID are going to somehow deal with it at home. And we're seeing the sickest of the sick. So we have this different perspective. And that's the perspective I think that a lot of people at home don't know about, don't see. That 10% get really, really sick, and you would not wish that on anybody that you really cared for, which is why I, too, completely urge everybody to get vaccinated.
And I think the piece that people don't focus on is, the economic impact it can have on someone. A lot of people are saying, if I get COVID, I'll just, get over it. Can you speak to how these people are going to be economically impacted by being in the ICU and on ventilators for?
Well, if you had a job, you're not working, right? If you're not working, you're not getting an income probably. If you're not having an income, you have bills to pay and you're not paying them, that's a problem, right? And you may not work for a long time if you're in that 10% or so of people that get really, really sick. So absolutely, there's going to be an economic impact.
And I also want to point out one more thing is that we are seeing postpartum patients too, women who have recently given birth to patients, to children, or who are also being admitted to our ICU. So I want to really reiterate here that unless your doctor has told you there's a contraindication of a severe allergic reaction to the vaccine, every person above the age of 5 should get vaccinated, pregnant or not, breastfeeding or not. If you have chronic medical conditions, and even more so, please get vaccinated.
Yeah, and there are a lot of people that read all kinds of rogue literature and so forth. You can really find a study about anything that supports any position out there printed in some sort of a journal. I would really urge people to not read information that is not, solid, reputable research, because it's only going to fuel the fire, for those people that believe that vaccinations are unsafe or that it's really okay to get COVID. I mean, just trust the people that treat people in hospitals that actually know what's going on. And when people are telling you that it's really bad and you should get vaccinated, please trust them. We've all been vaccinated. We've all been boosted. We trust this. And if we didn't trust it, why would we get the vaccine? We see the effects of not getting vaccinated. I urge you all to get vaccinated. It's the only thing that works.
You include in that group people that have had COVID too?
Yeah, so interestingly, if you are in the early generation of COVID, like let's say you got it in the first 3-4 months, right? We call that wild type COVID. That's the original version of COVID. The virus has gone through several iterations, right? Variations, mutations, so forth. And people that are now, let's say they've had COVID early on, they may not be immune through, quote, natural immunity to Delta variant or whatever else may be out there. Because, we're at Omicron. Right now there's a lot of variables or a lot of variants in between wild type and Omicron. And so, yes, that's why we see not only breakthrough cases in people that have had COVID, we also see breakthrough cases in people that have been immunized for COVID because the vaccine was designed for wild type COVID, right? So you still need to be really cognizant of the prevalence of this virus. And unless the vast majority of people get immunized, if that doesn't happen, the virus is going to be allowed to mutate. It's going to be allowed to mutate, and it's going to be to spread and become vaccine resistant. We're going to have to make a new vaccine. And so the way we can put the brakes on this thing is for everybody to get vaccinated and not allow us to be the vectors of transmission of the virus.
There's an argument out there that, the flu's never gone away, COVID-19 will never go away.
It's possible. It's possible. We don't know, but we do know that the flu vaccine was available during the season between fall and winter, and we have seen that people who were vaccinated for flu were not as sick as people who were unvaccinated for flu. So we don't know. We don't know how this virus will mutate, how it will evolve with time. What we do know is that the vaccines against flu worked, and the flu virus also mutates every year. That's why there's a new vaccine every year. Same thing applies to COVID too. So when people make an argument and say, oh, somebody got the vaccine and it's mutating, so what's the point? Flu virus mutates. We've known this for years, and every year there's a new vaccine for it or new variety for it. Same thing applies to COVID-19. COVID-19 will mutate. We need to get the vaccines and then get boosted too. One more important point I wanted to kind of mention right now with the upcoming holiday season, especially with Christmas and New Year holidays coming up, I really want people to focus also on indoor gatherings and meeting with their family members. That if you're vaccinated, great. Outdoors is fine, but still please practice social distancing when you are meeting with your family for Christmas time and holiday season, because again, you might be an asymptomatic carrier, but you might transmit the disease to someone who might be more sick or immunocompromised, and they might become more sicker than you would expect them to. So protect your loved ones too, and especially with the holiday season, be careful.
I want to go back a little bit to your question about, flu. It's been around for a long time, and, we have a vaccine, people get the flu. I try and use the analogy here of seatbelts, right? I've been wearing seatbelts for the 54 years that I've been alive. I've never been in any kind of accident where the seatbelt probably made any difference in my being injured or not being injured. But we all know that people die in auto accidents every day. And we also know, at least most of us have accepted the fact, that wearing a seatbelt decreases your risk, even though your risk is very small. I mean, most of us drive in cars and don't spend any time thinking about, oh, I could get in a fatal auto accident today, because it's a rare event. But we can make it even more rare by wearing a seatbelt. And this is the exact same thing with the vaccine. Most COVID infections will be mild, as Dr. Cole said. Some of them will be more severe, and we can reduce the percentage that are more severe by having a lot of people vaccinated, in the same way we reduce the percentage of fatal auto accidents by having everyone wear seatbelts when they're driving in a car.
I want to go back to an earlier topic about the procedures that people had scheduled. Like for those people that want to schedule an appointment or a surgery, how long do they have to wait? A couple weeks, 3 weeks? How long?
So we try to get everybody in, and we actually are still doing most surgery, right? All inpatient surgery. If they're hospitalized, they get their surgery. If people are being scheduled for surgery from the clinics, we are still doing most of it, but we are canceling some because we don't have a bed to put them in, right? And so we weigh the risks and benefits. If it's something that they've already waited 6 months, let's say they want their joint replaced, and we know that we can safely let them take some time, some of those people will be postponed. But to be honest with you, we're working really hard to get everybody, including those orthopedic patients, their surgery in a timely manner. But I can't tell you if it's going to be a week or 2 weeks or longer. It all depends on the COVID numbers. It all depends on how overwhelmed we get on a day-to-day basis, because numbers change rapidly, and they haven't decreased, but they go up pretty quickly.
But nobody will be denied emergency care. So let me put it like this. Nobody who walks through our emergency room doors or comes to our clinic will be denied emergency care. We will provide all the care that is required, and it will benefit them. But yes, some elective or semi-elective cases might be delayed or postponed a little bit depending on our bed situation.
And again, how many rooms are available as of now?
So this morning, the last time I looked, and this changes hourly, right? But we had 7 non-critical care beds available for adults and 1 critical care bed available. So the decisions about what surgeries might get postponed are made initially by a group of 3 people that includes Dr. Cole, a senior anesthesiologist, and our director of perioperative services. And they then call the surgeon to make sure they understand the nature of the case, and together make that decision about what's in the best interest of the patient. I mean, think about yourself as a patient. If you had something that, it'd be nice to get this done, but if there's a lot of people with COVID in the hospital, maybe I don't want to be there right now, and I'd rather put up with this pain or discomfort or inconvenience for a little while and do it in a month or 6 weeks when things are a little more calm. That's the kind of thing we're talking about. It's a very highly individualized decision that's made by experts in consultation with the patient's individual surgeon, and it's a small percentage of the procedures that we're doing right now, and we adjust it on a daily basis as we kind of project what availability we're going to have.
Is this going to get worse through winter, or is it going to?
I wish we knew the answer to that, right? I mean, I would not have predicted in the middle of the summer that this November, December would be worse than last November and December, but it is. And that's despite the fact that we have a vaccine that works. And the reason it's worse is because we haven't been able to get enough people vaccinated. So could it get worse than this? Absolutely it could. Might this be the peak of it? I sure hope so. In any case, 100 patients with COVID in a hospital, 23 of them in an ICU is way too many. And so we want to do everything we can to try and get that number down.
When you say you all are burnt out, can you talk a little bit more about that? Are you working longer hours? Are you seeing staff leaving? Can you
everything. It's all of the above, essentially. We have staff who are rolling over. The nurses are, of course, taking care of many more patients in the ICU. As physician, I'm the intensive care doctor. I'm taking care of, right now, 14 patients in my unit. 2 weeks ago, I was taking care of all 30 patients with my nurse practitioner, of course, and a whole team of people who were helping me out. But right now, it's almost impossible to take care of so many severely ill patients who are all ventilated, who have very high needs. So now we have 2 physicians rounding in our ICU with our team, of course, helping us out to taking care of these patients. So yes, we are working extra weekends, we are working extra hours, we are doubling up to take care of these patients. And I can speak for the nurses too. They're also taking care of extra patients, putting in extra hours, physically, taking care of these patients too.
How many patients would you typically have personally, if not for COVID-19? You said you have 14 right now. How many?
So before COVID was here, our ICU is always obviously 30 beds, of course, but we would have a mix of surgical patients, medical patients, non-critically ill but still requiring some critical care support patients. So we would carry on average 14 to 20 patients, but all of them were not on the ventilators. Now we are taking care of, let's say, like I told you, our ICU only has 1 open bed, and 23 of those patients are COVID ventilated patients, so they're all on the ventilators. Those patients require time. They require a lot of effort in just making sure that they are stable. A lot of effort goes into taking care of these patients.
So it's not necessarily a higher number, it's just the acuity.
The acuity is more, and the number is more too. It's both. So we have more patients who are more sick. So of course, both of the numbers have gone up.
What are your staffing levels like right now? Dr. Post, maybe a question for you. Do you know total staffing number changes from start of March 2020 to now?
So, I mean, I don't have the details I can give you. I can give you, an example. I know, for example, in our emergency department nurses were at about a 20% vacancy rate. So that means we have positions open for ED nurses that we cannot fill. That does not mean that on any given day we have 20% less nurses in the emergency department. What it means is that the nurses that remain in that pool are working more frequently, are doing more overtime. We're having to, when we can find the opportunity, we're having to call staffing agencies to bring in what we call travelers from other places to work in those shifts. So that's the kind of thing we're facing in those situations. That same, I don't know the numbers for you off the top of my head. I do know in the ICU we've had nurses who have decided to retire, who may have considered working a few more years, but it's so much. It's that they're there late in their shifts all the time. They're working more days than they ordinarily would be scheduled, and it just gets to be too much. And of course, we're all unique individuals, right? So somebody might be able to thrive in that environment longer than somebody else can manage to do it. So,
but as an intensive care doctor, I've been working for 14 years. I can tell you that nothing has been this emotionally exhausting for all of us as this pandemic has been. So there's a physical nature to it, but there's an emotional nature to it too. When you have patients, like I said, younger than yourself, who have children younger than my children, and I'm pronouncing them dead, it's very hard to make those phone calls and take care of these patients.
How can local leaders and lawmakers help you all?
I think the only thing I personally can see is that we all need to just get out and advocate for the vaccine. Like I said, prevention is better than cure. We know we have a vaccine against COVID-19. It's the only thing we know works against severe infection. We need everyone to speak out. If you have a family member, if you have a loved one in your community, our congressmen, our senators, whoever, just advocate for the vaccine. That's the one thing we know is effective.
What would you say to those that already have the vaccine in regards to the booster?
Yes, get the booster. I got booster. I think all of our staff I know of who are eligible for boosters have gotten the boosters. I can even say my 5-year-old child is vaccinated right now too. So anybody above the age of 5, if you do not have a contraindication of a severe allergic reaction, should get vaccinated. And if you're eligible for boosters, get the boosters.
More questions? Do you two just say and spell your name with your title?
Yeah, James Cole, C-O-L-E, Trauma Medical Director, Surgeon-in-Chief. Can I just add one more thing? You mentioned about influenza. More people have died from COVID-19 in 12 months than have died from influenza in 12 years. So that says something right there.